Well, colon cancer, it's the third deadliest form of cancer. But did you know that if you detect it early, well, you have a 90% chance of survival? Sharing more with us this morning is Dr. Sanjay Reddy. Good morning, doctor.
Good morning, Charles.
So how common is colon cancer?
Colon cancer is the third deadliest form of colon cancer, and it's second most common form of cause of cancer death in the U.S. after lung cancer. So it's quite a common cancer, although we don't often think about that and realize it. So that's the importance of screening, given that fact.
So speaking of screening, how do you prevent?
Well, the key to prevention is early detection, and we're really stressing following the standard guidelines of age 50 for asymptomatic, so patients who don't have any complaints at the age of 50 should really present for colon cancer screening. Actually, screening above the age of 50 decreases the likelihood by 85 to 90% that you'll have colon cancer. So that's quite an important key to preventing colon cancer.
Very important. And talk about some of the symptoms that one could see.
I think symptoms, in the past we've definitely relied on symptoms. The most common symptom of colon cancer, as we understand now, as we shift toward prevention, the most common symptom is no symptom at all, actually. And that's why it's important when you're healthy and feeling well at the age of 50 or age 45 in certain family history situations to present for screening at that age, because we just don't want to rely on symptoms. Oftentimes it's too late to prevent colon cancer when there are symptoms.
Yeah, and speaking of screening, today is National Cancer Screening Day. Tell us about the Stop Cancer Now.
Stop Colon Cancer Now
Yeah.
is a community-based group of over 1,000 committed gastroenterologists who are really committed and determined to get 2014 folks in for their first colon cancer screening today. And we think it's important because getting screened at the appropriate age is the key to preventing end-stage colon cancer and catching it early. Early detection and colonoscopy also allows us to remove any precancerous or suspect lesions at the time of the colonoscopy. So it's active prevention. It's both diagnostic as well as preventative in many cases.
And after your first screening, how often do you have to go afterwards?
Well, it's important to get a good quality colonoscopy, and if everything goes well, as we would hope, and the examination is normal and there's no other risk factors, we generally advise it every 10 years in most cases. So that's an important.
And nothing we have to worry about as far as, a lot of people are scared to go to doctors.
Sure, absolutely. It's understandable to have anxiety and fear over anything that's new, but we've really made significant strides in the last 10 years in improving safety, quality, patient comfort. Our patient satisfaction scores are approaching 100% at most of the outpatient centers, and we really stress the importance of deep, comfortable sedation and high-quality outpatient facilities for effectiveness, convenience, and safety.
Well, thank you so much. Great information. For more information, head to our website at dbz.com and click on the Daily Links tab.